and welcome to Supplement Saturday. I'm your host, Dr. Richard Harris, and this is a 5-minute or less hot take on one of our favorite supplements. And today we're going to continue a fan series where a fan asked about some holistic things they can take to help with allergies. Last time we talked about vitamin C. This week we're going to be talking about quercetin. Quercetin belongs to a group of molecules called flavonoids. Flavonoids are one of my favorite classes of molecules, very powerful antioxidants, food-based, and they're typically found in things like onions, berries, tea, kale, tomatoes, broccoli, green beans, and red wine. They can also be found in other herbs like ginkgo, St. John's wort, and American elder. So how does this quercetin work for allergies? Well, last time we talked about mast cells, right? Mast cells are a type of immune cell that are particularly active in the allergic type of response. And what they do is they secrete something called histamine. We talked about histamine. It is the mediator for our allergy symptoms. Histamine is the reason why you get runny nose, itchy eyes, that postnasal drip, skin rashes. And of course, the over-the-counter or prescription medications, antihistamines, are just that. They are antihistamine agents to block the effects of histamine. Well, quercetin does this naturally. It inhibits the mast cells from releasing histamine. Not only does it do that, but it blocks these mast cells from making more mast cells. So whenever there is an allergic type reaction or immune type reaction, your body wants to make more of those immune cells to fight off whatever is happening. So not only does it block the release of the histamine, but it also blocks more of these mast cells from being made. It also seems to be able to downregulate some inflammatory mediators, specifically COX enzyme and NF-κB. These are big fancy terms for just things that can cause inflammation that are active in inflammatory and allergy-like pathways. So quercetin is actually an antioxidant in low doses. In high doses, it's actually a pro-oxidant. And so some naturopaths will use high-dose quercetin in their cancer protocols because of this pro-oxidant effect. So what a pro-oxidant does is it actually causes a little DNA damage, causes some stress on the system, and then the body actually responds by making more of our own natural antioxidants. So what dose do people usually take? 500 milligrams daily. It's very well tolerated in oral doses, very few side effects reported in the literature. And quercetin is actually better absorbed with dietary fat. So I always recommend sprinkling some extra virgin olive oil or avocado oil on your veggies. It adds great taste, but it also adds good fat so you can better absorb some of these nutrients and vitamins that are more fat soluble. Now, the typical dietary intake is about 5 to 40 milligrams a day, but it can get up to 200 to 400 milligrams daily in people who are heavily plant-based. And if you remember the list of foods, onions, berries, kale, tomatoes, broccoli, these things are focused very heavily in a plant-based nutrition plan. They're some of the things that I eat quite regularly. So I hope you found this informative. Next week, we're going to stay in this allergy vein. We're going to talk about 2 more things. One of my favorite supplements, NAC. I don't take it for allergies, but it is something I recommend a lot. And bromelain from pineapples, actually. And that is another powerful anti-allergy agent. So those are what we're going to be talking about in the next 2 weeks. Thank you for watching Supplement Saturday. Again, I'm your host, Dr. Richard Harris. If you'd like to hear us talk about any particular supplement, please let us know. If you're looking for high quality supplements, check out our e-store at store.theghwellness.com, or you can head to our website, theghwellness.com, and check that out. All right. Thank you for listening and have a blessed Saturday.